Hello, this is Brian Scherff, physical therapist, going over the second most common vestibular maneuver I've seen in my 15 years experience running and working at a vestibular clinic. It is the Brandt-Daroff maneuver. It is a multi-purpose maneuver, and it can be very confusing because of its multi-purpose nature. It is generally used for the correction of BPPV, and it can also be used for general habituation. Generally, when it's used for correction of benign paroxysmal positional vertigo, BPPV, the general consensus is for the posterior canal. But when you research the Brandt-Daroff maneuver, you will find that it can be used for any of the three canal dysfunctions. It just happens that the posterior canal is 80 to 90, depending on percent, depending on which research study you read, the culprit. But it can be actually used for treating any of the three canals, and it is actually a very good maneuver to do after you've done an Epley's or 2 or 3 Epley maneuvers and it has not resolved sufficiently. Then this is a good general purpose maneuver to try with your patient. So, and they can do it at home, and generally this is something you may be doing at home. It's the best general maneuver if you don't really know what's going on with your vestibular dysfunction and your dizziness. But it is specifically for dizziness related to the inner ear dysfunction. So, with no more ado, let's get to the maneuver. To do the maneuver, you have the person or yourself. It's generally nice to have pillows. Turn their head 45 degrees. Then we rapidly go from here to here. And then you wait at least 30 seconds. The general consensus is you wait until all dizziness resolves and then another 30 seconds. If someone is still experiencing mild dizziness after 2 minutes, I move on with the maneuver. Because we're in video, we're going to fast track it. Let's say the dizziness resolved and 30 seconds went by and we go back up this way, head straight. Once you're up, you wait at least another 30 seconds. Time goes by because we're on the video and nobody's very patient. After 6 seconds, you're getting on something else. We go this way and this way. Good, and then we stay here for at least 30 seconds or until the dizziness resolves, and we go back and forth with this. So if the dizziness takes a minute to resolve, we wait longer, like another 30 seconds, then back up. And we lost the fellow. And we would continue doing that for the Brandt-Daroff maneuver. Most authorities say 5 repetitions each direction, which may take 10 minutes or more. I often do 3. Some of the older sources say up to 20 repetitions, which is ridiculous. To do it properly, that would take 45 minutes, and it is counterproductive in my opinion, and I don't recommend that. I recommend 3 to 5 depending on the patient's symptoms. Thank you.